Welcome back to Senior Alert USA. If you are a senior living in America right now, if you depend on Social Security, if Medicare is your lifeline, then I need you to stop everything you are doing and watch this video from start to finish. Because what is happening right now in June of 2026 is something that every single senior citizen in this country needs to know about. Your Medicare premium just crossed $200 a month for the first time in history. Your Social Security office might be closed. The staff that used to help you, more than 7,000 of them, are gone. And that small raise you got from the COLA increase, it is being eaten alive by rising costs. This is not fear. This is not drama. This is the reality that millions of American seniors are facing right now as we speak. This is Senior Alert USA, the channel that fights to keep you informed, protected, and one step ahead. If you are new here, I want you to hit that subscribe button right now and turn on the bell notification because we bring you the most important Social Security and Medicare updates every single week. And trust me, after today's video, you are going to want to stay connected with us. Now let us get into it. And folks, please share this video with every senior you know, because this information could genuinely change someone's life. Let us start with the big number that everyone has been talking about, the 2.8% cost of living adjustment, also known as COLA. Now, when the Social Security Administration announced this back in October of 2025, a lot of people were hopeful. They said, okay, at least we are getting a raise. The average monthly retirement benefit went from $2,015 to $2,071. That is roughly $56 more per month. $56. That sounds like something, right? But here is what they do not tell you in the headlines. Here is what the news anchors skip over. That $56 is not sitting in your pocket. It is being taken right back from you. Your Social Security COLA increase gives you $56 more per month, but your Medicare Part B premium just went up by $17.90 per month. That means right off the top, almost $18 of your raise is gone before you even see it. Now you are left with roughly $38 of actual new money. $38 a month. And what are you supposed to do with that $38? Let me tell you what is happening in the real world right now. Grocery prices have gone up 2.9% over the last year, according to the National Council on Aging. Housing costs are climbing. Utility bills are climbing. Gas prices are climbing. Prescription drug costs, even with some of the Part D improvements, are still a burden for millions of seniors. So you are getting $38 extra, and your real expenses are going up by much more than that. This is what I call the COLA illusion. On paper, it looks like you are getting a raise. In reality, you are falling behind. And folks, 77% of older adults told AARP in a survey last year that even a 3% COLA would not be enough to keep up with rising prices. They were right. 2.8% is certainly not enough. Now, let me be clear. I am not saying COLA is bad. It is better than nothing. It is better than the 0% adjustments we have seen in some past years. But it is not the victory that some people are making it out to be. For millions of seniors living on a fixed income, this raise barely covers one extra trip to the grocery store each month. And that brings me to the first piece of truly terrible news. For the first time in the history of the Medicare program, the standard Part B monthly premium has crossed the $200 mark. It is now $202.90. Let me say that again. $202.90. Every single month, automatically deducted from your Social Security check before you ever see a penny. In 2025, that premium was $185. So, in just 1 year, it jumped by $17.90. That is a 9.7% increase, almost 10%. Now think about that. Your Social Security went up 2.8%. Your Medicare premium went up 9.7%. Do you see the problem here? The cost of your healthcare is rising 3.5 times faster than your benefit increase. That math does not work in your favor. But it does not stop at the monthly premium. Let me walk you through all the Medicare cost increases for 2026. The Part B annual deductible has gone up from $257 to $283. That is a $26 increase. This is the amount you have to pay out of your own pocket before Medicare even starts covering your doctor visits and outpatient services. The The Part A hospital deductible, the amount you pay when you are admitted to the hospital, has gone up to $1,762 per benefit period. Per benefit period. That means if you go to the hospital twice in 1 year for separate issues, you could be paying that amount twice. And for those of you with higher incomes, the IRMAA surcharges, that is, the income-related monthly adjustment amount, those have also gone up. If your modified adjusted gross income is above certain thresholds, you could be paying Part B premiums as high as $689.90 per month. Now, there is some mixed news on the Medicare Part D side, the prescription drug coverage. The out-of-pocket cap for drug costs is now set at $2,100 per year. That is actually a new protection that limits how much you pay for medications in a given year. And the donut hole coverage gap is gone. So prescription drug costs may be a little more predictable, but the overall cost of Medicare, the premiums, the deductibles, the copays, is going up across the board. And here is what really breaks my heart. Many seniors are making impossible choices right now. Do I pay for my medication, or do I buy groceries this week? Do I go see the doctor, or do I save that money for my electricity bill? These are not hypothetical questions. This is happening every single day in cities and small towns all across America. The Medicare premium crossing $200 is not just a number. It is a milestone that represents a system that is squeezing seniors harder and harder every single year. Now, if the Medicare increases were the only bad news, that would be enough to worry about. But what I'm about to tell you is, in my opinion, even more damaging. And it is something that is not getting nearly enough attention. The Department of Government Efficiency, known as DOGE, which was created under the Trump administration, has made massive cuts to the Social Security Administration, and the impact on seniors is devastating. Let me give you the facts. More than 7,100 Social Security Administration employees have been cut. That is more than 13% of the entire workforce. According to Fortune magazine, this is the largest staffing cut in the history of the Social Security Administration. The largest ever. 6 out of 10 regional offices have been closed. 47 field offices across the country have been listed for closure or consolidation. As of this week, offices in Arizona, California, Florida, Hawaii, Iowa, Maryland, Michigan, Montana, and Pennsylvania are either operating on a limited basis, appointment only, or completely closed to the public. Now, let me tell you what this means in real life. Because the numbers are one thing, the human impact is another. Imagine you are a 75-year-old woman living in a rural town in Montana. You need to update your Social Security information. You do not have a computer. You do not know how to use the internet. Your nearest Social Security office used to be 30 minutes away. Now it is closed. The next closest one is 2 hours away. And when you call the phone number, you wait on hold for over an hour, only to be connected to an AI chatbot that does not understand your question. This is not a made-up story. This is what is actually happening. Researchers from 3 major universities, California State University, Sacramento, Binghamton University, and the University of Wisconsin-Madison, conducted a study that was published in March of this year. They interviewed 52 benefits advocates at 32 nonprofit organizations across the country. And what they found is alarming. Phone wait times have skyrocketed. When you do get through, you might be routed to a field office in a completely different region that cannot help you. Specialized staff who understood the complex rules of disability benefits and retirement benefits have been laid off, and the remaining workers are overwhelmed and sometimes less experienced. One paralegal they interviewed, who they called Jane to protect her identity, said, and I am quoting here, "I just have so many cases that are stuck in purgatory because they do not have enough workers to work them. They do not have enough workers to answer the phone to tell me what is happening to them." Another benefits representative named Freddie in the Denver region said, "Now, we cannot reach anybody at Social Security. We cannot get through to make an appointment." And folks, it gets worse. The study found multiple cases of terminally ill clients who died while waiting for their disability benefits to be processed. People who were eligible for benefits. People who had submitted their paperwork. But the system was so backed up, so understaffed, that their cases just sat there. One attorney described a homeless, seriously ill woman whose paperwork had been lost by the Social Security Administration. The attorney was told the staff could not locate documents that had been submitted 3 years earlier. 3 years! And this woman was dying. The Social Security Administration also removed key customer service metrics from its website in June of 2025. That means the public can no longer see data on phone wait times or disability claim processing times. The transparency is gone. And here is what makes this even more frustrating. The administration pushed many services online, saying people should use digital platforms instead of visiting offices. But think about who we are talking about. We are talking about seniors in their 70s and 80s. We are talking about people with disabilities, people who are homeless, people who do not have reliable internet access. Telling them to go online is not a solution. It is an abandonment. The Urban Institute, a nonpartisan research center, found that in the first half of 2025, 7% fewer disability claims were even submitted compared to the year before. That does not mean fewer people needed help. It means fewer people could get through the system to ask for help. This is a crisis, and it is a crisis that is disproportionately hitting the most vulnerable people in our country: seniors, people with disabilities, rural communities, and low-income Americans. Now, I know this has been a lot of heavy news, and I know some of you watching this right now might be feeling angry. You might be feeling scared. You might be feeling helpless. But I want you to know something. You are not helpless. There are steps you can take right now to protect yourself and your benefits. Number 1, create your My Social Security account online if you have not done so already. Go to ssa.gov/myaccount. Even if you are not comfortable with computers, ask a family member, a grandchild, a neighbor, or a trusted friend to help you set it up. This account lets you check your benefit amount, your payment dates, and your personal information without having to call or visit an office. Number 2, know your June payment dates. If your birthday falls between the 1st and the 10th, your payment comes on June 10th. If it falls between the 11th and the 20th, your payment comes June 17th. If it falls between the 21st and the 31st, your payment comes June 24th. SSI recipients, your payment was June 1st. Number 3, check whether you qualify for extra help with Medicare costs. There is a program called Medicare Savings Programs that can help pay your Part B premium if your income is low enough. Many seniors who qualify do not even know these programs exist. Contact your State Health Insurance Assistance Program, also known as SHIP, for free help. Number 4, review the new senior tax deduction. If you are 65 or older, you may qualify for a new $6,000 tax deduction that was signed into law. For single filers with income up to $75,000 or married couples filing jointly up to $150,000, this could reduce or even eliminate your taxes on Social Security income. Number 5, watch out for scams. The Social Security Administration will never call you and demand payment by gift card, cryptocurrency, or wire transfer. If someone calls you and says your Social Security number has been suspended, hang up immediately. It is a scam. Number 6, contact your elected representatives. Call your congressman, call your senator. Tell them that Social Security office closures are hurting you. Tell them that Medicare costs are too high. Your voice matters. These are public servants who work for you, and they need to hear from you. And number 7, stay informed. Subscribe to this channel, Senior Alert USA. We are here for one reason and one reason only, and that is to make sure you know what is happening with your benefits before it is too late. Every week, we bring you the latest updates, the real numbers, and the information you need to protect your financial future. Before I let you go, I want to speak to you directly. Not as a host, not as a news reporter, but as someone who genuinely cares about the seniors of this country. You spent your whole life working. You paid into Social Security every single paycheck. You were told that when you retire, the system would take care of you. And now, in 2026, you are watching your Medicare costs go through the roof. Your Social Security offices shut down. The staff who are supposed to help you get fired. And your monthly raise gets swallowed up before it even reaches your bank account. That is not right, and you deserve better. I cannot fix the system by myself, and neither can you. But together, by staying informed, by speaking up, and by sharing this information with every senior we know, we can make sure that nobody faces these challenges alone and in the dark. So here's what I am asking you to do right now. First, hit that subscribe button if you have not already. We are building the biggest community of informed, empowered seniors on YouTube, and I want you to be part of it. Second, share this video. Send it to your spouse. Send it to your neighbor. Post it in your church group. Share it on Facebook. Text the link to your kids and grandkids. The more people who see this, the louder our voice becomes. And third, drop a comment below. Tell me how these changes are affecting you. Tell me your story. I read every single comment, and your experience matters to me and to everyone in this community. Thank you for watching Senior Alert USA. I will see you in the next one. Until then, stay alert, stay informed, and take care of each other. God bless.